Now next presenter is Dr. GYAN BHASKAR. He is presenting on oculoplasty management and role of artificial intelligence. He is the professor and head unit 2 of RIO Indira Gandhi Institute of Medical Sciences, Patna, and he is secretary of Patna Ophthalmic Society, and he is a PG examination of different university, and he is awarded gold medal by the Bihar Film Society. He has various publications in PubMed and index journals and presented national, international and state-wise conference. Now, Dr. GYAN BHASKAR, please go through your presentation.
Thank you. Thank you so much, sir. Good evening, everyone. Now I'm going to discuss about the oculoplastic management and role of artificial intelligence. For the diagnosis and proper management of oculoplastic cases, we are totally dependent upon the clinical evaluation. And for that, we require a highly skilled and experienced surgeon. Even there are chances of human error, and not every case could be handled with perfection. Moreover, in our country, there are large number of patients concerning the same, but in contrast, a relatively lesser number of expert ophthalmologists and expertise center are present. So the role come the need of development of artificial intelligence that would enable proper diagnosis, evaluation of the disease, and it would be beneficial for both patient and the general ophthalmologist. Allowing the former and access to perfection and later an opportunity to achieving early diagnosis and proper management. In cases of oculoplastic surgery, it is a specialized eye treatment. It includes the eyelids, eyebrow, orbit, tear ducts, and sometimes faces. And oculoplastic surgery ranging from the improving to the treatment of the dropping of the eyelid to the replacement of the eye. Based on the research and literature available, I will discuss about the blepharoptosis and lid mass, and the software that has been developed by the researchers and for their diagnosis and management. In cases of evaluation of the management of ptosis, as you see, there are three photographs: the dropping of the upper eyelid of the child, younger age and older age group. Overall, the past few years, development of artificial intelligence, most notably deep learning, have significantly increased the capability of machine to stimulate human-like perceptual judgment. The AI approaches to facial analysis show promise in clinical evaluation of abnormal lid position. It could allow more neutralistic, qualitative and automated assessment of the lid position. Some software available like convolutional neural network architecture such as VGG16, ResNet, DenseT diagnose the true blepharoptosis without any input of eyelid measurement from the clinical photographs. In the photographs, simply photographs can be taken by a handheld camera, any handheld camera, in order to crop a standardized image of a single eye. An open face and open source package was utilized to identify major facial landmarks in each photographs. For the ptosis classification, most of the common models such as VCG, ResNet, AIOC2022 and SqueezeNet and DenseT were used. All have similar performance, and therefore among those models we can choose the relatively simpler model, that is the VCC16, a computerized resource efficiency model. It is a base model and it is developed by the Oxford Visual Geometry Group. And some gradient weightage class activation map, that is a grand map, is a visual explanation of the AI model which is applicable to wide variety of CN model families. And for the understanding of AI model prediction, a heat map can be used to identify the area of input image that contribute most of the AI model classification using a technique called class activation map. This photographs was taken from the net. It is the shows the original photographs with the merged with the grand map photographs, shows the amount of the ptosis, blepharoptosis, and healthy position of the eyelid. Another model, that is a bespoke automated image analysis tool, has been developed for the express purpose of assessing the eyelid position. Generally, we measure the eyelid with the scales or ruler regarding the ptosis evaluation, like MRD1, MRD2, pulpitular aperture, levator function. But these tools can analyze these things automatically. And another model is used for assessment of the peripheral measurement, automated measurement of the eyelid. The deep learning semantic segmentation network can be used to fully automated periorbital measurement. Three area of the each photo, like eyelid, aperture, iris, eyebrow, can be segmented bilaterally, and this segmentation will then be used to train the deep learning semantic segmentation model consisting of Valena PSP net with the ResNet 50 backbone with UNet style of sampling arm. In cases of the eyelid, we know that the benign and malignant eyelid tumors sometimes have overlapping feature, and hence differentiating between them are to be challenging. Just to see here, some photographs from the are taken lower and upper lid. Some are the malignant one, and some are the benign lesion, and it is sometimes very difficult to diagnose clinically without use of pathological examination. So literature available recently published artificial intelligence detect malignant eyelid tumor from the photographs, and these work on the difference diagnosis on the based on artificial intelligence for the early diagnosis. And for classic deep learning algorithm like DenseNet Net 121, ResNet 50, Inception V3, and VG16 can be used to train a model to distinguish malignant eyelid tumor from the benign one. And these photographs are also taken from the net on this based on the literature that you see here. The dotted green line are the healthy one, and orange line shows the detected result by the RCNN. And to investigate the interpretability of the system in classifying benign and malignant eyelid tumor, heat map can be created to visualize the region that contributed most of the system decision. The heat map could highlight the region of benign and malignant eyelid tumor, regardless of size, location, and shape of the tumor. It is also taken from the net of the same study that the original photograph. This is the original program. This is the crop one, and this is the tumor-centered heat map was. Heat map was created so that we can distinguish between the malignant and benign tumor. This is the benign lesion, and also cropped image was centered with the heat map. So conclude that open source artificial intelligence-based facial analysis software will able to perform a good level of agreement and manual human assessment of the pulpitular aperture. AI-assisted ptosis diagnosis tool can be the great impact on the management of congenital ptosis, since up to 1/3 of the congenital ptosis patients are at risk of amblyopia. The accurate diagnosis of ptosis based on the external photograph would prove especially helpful in pediatric population, as the eyelid examination can be challenging in uncooperative or crying children, patients with developmental delay, and babies. And heat map could highlight the region of benign and malignant eyelid tumor regardless of size, location, shape of the tumor, and thus can be helpful treating the eyelid tumor. Thank you so much for your patience hearing.
Thank you, Gyan, for your nice presentation.
Next, just one thing I would like to highlight. I mean, the last line that you said, the differentiation and to differentiate between a malignant and a benign tumor, if that can be done by artificial intelligence, that will be a boon for everybody.
Yes, sir.
We have the